I'm frankly pretty bewildered that our friends on the other side of the aisle are expressing such strong objection to reducing subsidies for Americans who earn, by the way, $500,000 a year for their health coverage to help us pay for low income. We already have embraced the notion that wealthy seniors who are making more than $500,000 a year should receive less taxpayer subsidies. That's in the law today. In fact, President Obama supported an even bigger version of this idea in his budget, and Washington Democrats did the same thing in the ACA. This is a pattern that's been there, and President Obama actually supported an even bigger version of this idea. We merely say those very few individuals who are generating $500,000 a year and are on Medicare, they have that income, they could help out a little bit more. We're talking a grand total of about $135 a month, more that somebody making $500,000 a year could pay into Medicare. And that allows us to have the funds to pay for a 5-year extension of SCHIP at the bump-up rate of 23% next year, the year after, and as the Senate proposed in a bipartisan way, 11.5% after that, going forward, the third year, and then down as they do in the Senate. Now, who does this impact? You want to talk about the top 1%? We're probably less than the top 1%. These beneficiaries would still have access to the full Part B and D benefit. CBO, according to the feedback from CBO, of the less than 1% of impacted beneficiaries, 5% of these, of less than those beneficiaries, might have a behavior change and opt out to self-insure. But ironically, if the committee could come to order, please. Committee could come to order. So what we're talking about here is people making $500,000 a year on Medicare. By the way, we have data that shows that these would be equivalent to the gold tier plans. If they wanted to opt out, they'd probably pay 3 times as much for equivalent private sector insurance. 3 times, 2.5, 3 times, depends upon where you are. Second, when it comes to the Virgin Islands, the resident commissioner of the Virgin Islands, Stacey Plaskett, approached me on the floor this week and said, even though basically their Medicare issue it matters a lot, she wanted help on it, and we said absolutely. So our staffs have worked since that time to say what is it the Virgin Islands needs to solve their Medicaid problem, and because we had to have the base bill filed earlier, we're adding that as an amendment. Mr. Bilirakis has that on his plate. He'll be offering that soon. When it comes to the DISH payments, it's kind of ironic that the majority, the Democrats, say we're trying to repeal Obamacare and we are, and replace it. However, this cut that they want to turn off, which we're with them on turning off, is part of Obamacare. That's part of the ACA, is to have this DISH cut in law. We're turning off part of Obamacare, DISH cut, to help our hospitals. And we do that in here. Now, when it comes to the prevention fund, if you look at the statutory language, and somebody has it here, and they'll talk about it soon, of what the prevention fund is supposed to be used for, it is to help with prevention and wellness. That's all it says. And $2 billion a year mandatory money goes into that fund. We're just using that fund and the $2 billion a year to pay for our community health centers. Don't they do prevention? They do in my district. Don't they do wellness for people? They do in my district. So we thought it was appropriate to use a fund that $2 billion a year just goes into, and HHS can figure out how to spend it or not, to actually put it toward something that's proven in every one of our districts and communities, and that's the community health fund, or the community health centers. So we pay for 2 years full funding for community health centers out of the Wellness and Prevention Fund. It seems like a logical place to go find the money to pay for this. We take care of the diabetes issue that we all care deeply about. So we take care of health centers. We take care of CHIP fully and equally to where the Senate is. By the way, the Senate bipartisan plan has no pay-fors. They agreed on the spend, but they don't have any pay-fors they voted on today that I'm aware of. We're actually doing the combined heavy lift here, finding how do you pay for something that's really important and try to make it as budget neutral as you can. And we do that in this proposal, the proposals we'll have before us today. We had an opportunity to be partisan, and we had an opportunity to get this done ahead of the 30th. On 2 occasions, we had markups scheduled, if you will, to deal with this before the end of the month. And on both times, in a collaborative level, we agreed to postpone those while the negotiations continued. So it's a little frustrating to sit here today and get hammered at for missing the deadline when we could have moved forward, even though we didn't have an agreement then. We don't have it today before the 30th. But out of courtesy and respect, out of my desire to try to come to a bipartisan deal, we put off at least 2 markups. There were other issues too. Things happen in this business. We were trying to get our work done. We knew that the states had the money for their S-chip. We knew they had it for their community health centers, and I was open to giving this more time, and by the way, I still am. But we have to move forward at some point. If we can find something before we go to the floor that works, great. But we had to move forward. So with that, my time's expired. I recognize, I guess,